It's not that these days people are getting much more mental disturbance, though you could look at it that they are getting much more mental disturbance. One, because there are more people in Uganda than where they were before, so there's an increase in population. And like we always say, for as long as they are human beings, there will always be mental illness. So the more people, the more mental illness. But that said, I think there's also an increase in awareness of mental health problems. So it might seem like there are more people, but only that more people are now recognizing that people are unwell. But we also have to acknowledge that there are more risk factors that lead to mental illness. There's an increase in substance use, alcohol and substance use. We are still dealing with HIV, which is related to a lot of mental health problems. And also, there are a lot of distresses in society. And because people are not able to access services early enough to deal with their initial distresses or early signs of mental health problems, these get prolonged and develop into severe mental illnesses. So that can explain part of that feeling that there is more mental illness these days than before. Schizophrenia is what we call a psychotic illness. And a psychotic illness is one in which one's perception of reality is disturbed. They tend to experience certain things which are unreal to others, but in their own experience, they experience them like hearing a voice of someone talk to you, but that is not evident to someone else, or seeing things which others are not seeing. So those are the prominent symptoms in schizophrenia. In bipolar, which we call a mood disorder, it's characterized mainly by a prolonged disturbance of emotions. Either the emotions are so, one is in such an excited state for a prolonged period of time, or a state of low mood, and that is the depression. Now bipolar has, one with bipolar has episodes of both elevated mood, which we call mania, and low mood, which we call depression, at different times, though sometimes they might occur together.
I got ill in 1998, and I started with a depression episode. And I was treated with electroconvulsional therapy, that is ECT, whereby a certain amount of electrical current is passed through your brain. And they say that is one of the most effective ways for severe depression, because I was suicidal. I wanted to commit suicide. I thought that it was the end of the world. Then afterwards, when I went back home after that treatment, I went into a manic phase whereby I became so excited. I was acting a play, and I started forcing people off the street to come and see my play, and people knew that there was something wrong. Then that's when I was diagnosed with bipolar, because I had shown both poles, the depression and the mania.
Libido is one of the signs of mania. Like I've just described mania, mania is one of the phases of bipolar affective disorder. And in mania, a lot of the aspects of our body function are on the high side. One experiences a lot of energy, sometimes a lot of appetite, though with no time to eat, a lot of excitement in their emotions. So in the same vein, you also get a lot of sexual excitement, which is libido. When you come to hospital because of a mental illness, we, the healthcare providers, do an assessment to determine how ill you are. If we find that you can actually take treatment for your mental health problem as an outpatient, meaning that you can go home and come in once in a while, then we do that. But for most persons with severe mental illnesses, then they have to be admitted. I don't know whether that's what they mean by locking them up. And the thing about severe mental illnesses is that it affects your mind such that you're not able to realize that you're sick. And so in that case, we make a decision for you. And then you have to be admitted to hospital. And depending on your rate of recovery, your rate of response to the treatment, that depends on how long you will stay in hospital. Not locked up, unfortunately that's how it might seem, but in hospital as an inpatient, then eventually become an outpatient. Yes, you need to continue taking your medication for as long as the healthcare provider has advised you to take medication. Because many times we take medication and then when we feel well, we go off medication. But that makes it more likely that the sickness returns. Because you feeling better does not mean the sickness has gone away. The medication helps to control the illness because a lot of the mental illnesses are controlled, not cured by medication. Yes, they can. We treat illnesses, but we care for individuals. And when you present with an illness, we treat you in your own right as an individual. And different people with psychotic illnesses will present differently in as much as they might have the same illness. And their response to treatment might be different, and so their rate of recovery might be different. And there might come a time when you together with the health worker make that decision that maybe now, since we have managed the illness up to this point in time, we might either reduce the drugs to a minimum or consider a drug holiday. But again, it depends on a lot of factors, and importantly, it's the healthcare provider too to make that decision. In order not to relapse, it is important to first of all get an understanding of the illness for which you're being treated. And as part of understanding the illness for which you're being treated, you need to understand its symptoms and the medication you're being given and why you need to take that medication. Secondly, it is important that you comply with the advice that your healthcare provider has given you. And it's always easier to comply if you have an understanding of why you're taking the illness. But importantly, it is important to stay on your treatment, not to go off your treatment, because most relapses are brought about by going off treatment. Thirdly, it is important that not only do you take your treatment, but you also care for your whole being, mentally and physically, because you might take your medication, have an understanding of your illness, but if you're not caring for your overall health, if you're not sleeping enough, or taking substances of abuse which affect your mind, alcohol or other substances of abuse, those might affect your rate of recovery and might actually result in a relapse. I think the first place where you can learn is through the interaction with your healthcare provider. When you're meeting with them and trying to get an understanding of your illness, you have the opportunity to ask so many questions about your illness, because indeed many times you really don't have an understanding. So they can't give you a lot of the information that you're seeking for. But also, you can then go on and read about your illness, either from books, from credible sites on the internet. You can also share with peers who are living with the same illness, fellow peers, and learn how to live with your illness. And you can also, from the media sometimes, they can give you some information. And then, you can actively go out and seek from different sources, because the information is there for most of these mental illnesses. Yes. What you need to do for your natural sleep is to maintain your sleep hygiene. And that means that you have a time to sleep where you actually purposefully go to sleep. You have that time, you go to bed, and you sleep, so that you don't go to bed and maybe play loud music. You can play soft music that will allow you to sleep, or read a book that will take you to sleep. But if you're doing something, you know, reading, doing a lot of work at night, yes, studying a lot at night, then that is going to affect your sleep. So that is part of the sleep hygiene. You need to purpose it that you go and make sure that you sleep. But it is also helped by making sure that during the day, you do the activities that you ought to do. If you're to sleep during the day, you can take maybe a 30-minute nap. It is also important that you watch what you eat, especially late in the evening before you go to sleep. Hopefully you have a meal at least 2 hours before you go to sleep. And you avoid substances that take away your sleep, like the substances of abuse, or like alcohol. Alcohol might initially make you feel sleepy, but eventually it disrupts your sleep cycle. So it involves having a balanced life, making sure you're physically well and also mentally well. Then with time you don't need the drugs to make you sleep, but to control your illness. Again, like we say, someone living with schizophrenia, it depends on when you're presented with it, how long you've been on treatment for it, because different people with schizophrenia have different outcomes. So the answer to that is it really depends on you, the individual, and the way the illness has impacted on your life. I wouldn't answer that, what should I expect, because it all depends. Like I said, we treat the illness, but we care for the individual. So every individual has different challenges, different opportunities, which we work with. So that is a question that would only answer to an individual patient whom we are working with, or service user. Epilepsy in most cases requires one to take medication for a long time. And we rarely talk of curing epilepsy. It is also one of those long-term, or what we call chronic illnesses, where the illness is controlled by medication but not cured. And it is important for many people who are living with epilepsy to understand this. And indeed, it is always difficult for anybody taking medication for a long time to continue with medication. There are challenges, but yet that is the better option, because it keeps you healthy and well. And so like we do for other illnesses, which, whether physical or mental, which take a long time, which we call the chronic illnesses, we advise you to take medication as we keep reviewing you. There might be a time where we feel that at a certain point in time, where again we can consider a drug holiday, but we don't say that the illness has been cured, because we use both medication and also other lifestyle changes to manage the epilepsy. So I wouldn't talk of cure. I would advise that you continue taking your medication. It's challenging, but it's what really will keep you well, because once you go off it, then it's highly likely that the illness recurs. Again, it depends on what type of mental illness is. Sometimes sometimes it's a short form of mental illness, which, if treated at that point in time and dealing with the cause at that point in time, then it is likely that it might not return. And in that case, you might say, okay, that maybe that episode has been cured. But for a number of mental illnesses, like say bipolar, schizophrenia, some forms of depression, there's always a likelihood that the illness will return. And that's why we don't talk about cure, but long-term treatment and control. Just like for other illnesses, like we talk about diabetes, high blood pressure, we don't usually say we have cured high blood pressure or diabetes, but we talk about long-term treatment aiming at recovery. a certain level. Mental illness is scary to people because of what people think mental illness to be. They don't consider it to be a sickness like any other sickness. It is perceived to be a state caused by usually circumstances beyond human beings. Either it is curses or spirits or witchcraft. So that attribution to other causes, usually supernatural, is what causes the scariness of mental illness, because many people then feel helpless and feel that, you know, this situation is uncontrollable and yet we can't help. So that brings a lot about the scare associated with mental illness, and eventually creates the stigma that prevents people from accessing help and the appropriate treatment.
We have so many beliefs regarding mental illness. Some people believe that you are mentally ill because you must have done something wrong, or your parents might have done something wrong, and this is like the result of what you have done. But that is not true. Some people think you have been witched. Yes, sometimes it may be true, but in most cases it's also not true. See, it's all also a mindset.
The way we approach our care is that, yes, at the time you come in, you might be feeling unwell, and what makes it an illness is because at that time you're not able to function as you would, so you're not able to work. But as we start the care, using medication, using counseling, we also try to aim at helping you rediscover your abilities, or helping you learn, like here in Butabika, learn new skills. For example, going to the occupational therapy department and learning new skills which can help you get a job. We don't help you get a job, but we help you on the journey of recovery and empower you to be able to get a job on yourself, because that in itself will help you recover. Right now in Butabika we don't have exchange programs, but we hope that in future with the peer support worker program there might be opportunities for exchange programs, either within the nation, within the country Uganda. Peers from Kampala can exchange with peers from Gulu, Kabale, Mbale, and learn from each other, or even internationally, whether it's within East Africa or between Uganda and England, where we already have a collaboration. There is that opportunity. But for now, we are working on having the peers who are accessing services from Butabika first come together, learn how to support each other, learn from each other, and with that we shall build a network where eventually we can have exchange programs. The mental health services in Uganda, in the Uganda government health system, are free. So I think that helps to improve access to mental health care for anybody and any family which is affected by mental health problems. There is a cost which comes in terms of really either going to the point of care, and if you're admitted, being, people visiting you, bringing you some food and offering some other aspects of care. And that one is beyond us. I think in care, there's usually a partnership between the healthcare providers and you and your family, if you can, because we are also limited in what we can do. But you don't usually have to pay the healthcare professional to see you. For as long as you can get to the point of care, the mental health professional will see you. Thank you for listening, and I hope this was helpful, and wishing you all good mental health.